Hospice offers a number of programs for somebody who is terminally ill, or as we like to refer to it, who has received a life-changing diagnosis. And we use the word life-changing because hospice really is about living. It's not really about dying. And so every service that we provide is really to be able to offer an incredible quality of life as somebody is walking their path of treatment and diagnosis and so forth. So one of the things that we offer is what we call a day hospice. And at a day hospice, our client would come. They would enjoy a nice breakfast. We always have a therapeutic craft that they will do. So it may be something with art therapy. It may be the creation of a memory box. It might be container gardening. It really is an opportunity for them to sort of get their hands into something and do something creative that can be a therapeutic outlet. We also provide them with a wonderful lunch and an afternoon's entertainment. So when somebody is at day hospice, it really gives their caregiver an opportunity to go and do some of the things that he or she may need to do. So it's a break for the caregiver and it's a break for our client. When somebody is progressing in their illness and may not feel up to coming to day hospice, we have an opportunity for them to receive in-home companioning. So we will send in a trained hospice volunteer who will sit with them, who will talk with them, will help them with some journaling if they're wanting to do that. It also gives their caregiver an opportunity to have a bit of a rest as well because they know that their loved one is in good hands. They're in the hands of somebody who's trained to help them along the path. The other thing that we do provide is counseling and support. There is a process that we all go through when we've received a major change in our lives called anticipatory grief. And so we provide one-on-one counseling for our clients so they have a chance to talk through any of the fears that they're having, any of the concerns. Those concerns might be for their loved ones, those concerns may be for themselves, but it's an opportunity for them to have an ear that can be lent for them to discuss anything that they really need to talk about, but may not feel comfortable talking to their caregiver about because they're nervous or they're worried about burdening their loved one even more so than they already have. Another thing that we offer, which is quite unique to Daval Hospice, is a number of pet care services. What we found was that when somebody is going through the path of treatment and doctor's appointments, the family pet can often be may often not be getting as much care as they normally would. So whether it's yard cleanup, whether it's pet walking, whether it's pet sitting, because they have to travel out of town for a medical procedure or maybe just to get a bit of a break, we also provide a pet care service. And all of those things, regardless of what somebody requires, we offer free of charge. So money should never stand in the way of somebody receiving the services that our hospice provides.